Uh, in the previous session, we talked about the Oedipus and Oedipal phase at the 5th year of age and how the trauma in that age emotionally could cause changes. Now, we have to come to the question about what do we do with that and how do we treat it. The issue with the treatment of this kind of situation, first by analytic observation of the associations and the problems that the patient is exhibiting in their lifestyle relatedness with the world, and then to first to have a supportive environment to be able to enact this kind of like growing up type of a relationship. Because when we go to therapy and sit down and talk to a psychiatrist or therapist, basically symbolically we are going to a symbolic father or mother to be grown up again in that family, so to speak. And then we're going to be doing the same, we're going to be acting and we're going to be dealing with the problems that we went through in our childhood and reenacted unconsciously with regard to rejections, feelings of guilt, feeling of loss. We go in a relationship being very guilty, being very concerned about our therapists, very concerned about our psychiatrists, about how they're doing, what they're doing, what's happening to them. And then this kind of signs and symptoms are going to be related in the relationship, in the therapeutic relationship, and then interpreted to the patient whether they're very guilty about this relationship that they are involved with, because possibly going back to their childhood when their sister, their brother, their father and mother died or had a severe accident that they felt so guilt-ridden that they kind of like began to enact and be such a good person to be feeling very guilty and not to express their feelings, which in case in eating disorders we have a lot of then overeating, and then we have conflicted eating disorder with regard to bulimia, which is overeating and then throwing up. So it means like, you know, getting things in us and keeping there, but then have conflict to keep it there and then throw it away. Wanting something so bad and then at the same time rejecting that. So, sorry, these conflicts could be dealt with and worked through by the examination of the relationship of the patient in the therapeutic setting. And then a lot of interconnections between the eating disorders and the way we relate to the world, as I discussed before, with bulimia being conflicted about wanting and keeping everything inside, and then at the same time rejecting that and throwing it up, with anorexia, with restriction, with trying to control our feelings, control our relationships, control our environment, which is another way of depiction of our relationship with the object world. And then the treatment basically goes through psychotherapeutic involvement and therapy, and also with medication, combination of that, which I will discuss more in the future.